Good afternoon. I'll be talking today about policy development, how institutions can support policy that advances parenting, focusing specifically on the case of the Doha International Family Institute, which is a member of Qatar Foundation for Education, Science, and Community Development. I'd like to start by giving you a quick introduction about DIFI, which is a global policy and advocacy institute working to advance knowledge on Arab families and promote evidence-based policies at the national, regional, and international levels. We use an impact model which is focused on three main pillars, and that's research, policy, and advocacy. So with research, we produce evidence through high quality policy-oriented research, which is utilized for policy and program transformation, in addition to fostering knowledge on Arab families at the national, regional, and international levels. The policy then transforms this evidence into policy outputs and promotes the development of policies and programs and best practices to strengthen and support families. And then advocacy, we advocate for family cohesion and promote the transformation of evidence-based policy and program outputs into measurable impact, while nudging for change and engaging stakeholders and enhancing DIFI's visibility and outreach at the same time. So I'll be giving some examples from DIFI's research. These are only some examples that I've selected that are linked somehow to parenting. And I'd like to highlight here that all of our reports can be found on our website. So DIFI conducted a study on parenting programs in the Arab region in 2018, which mapped the parenting education programs across the Arab countries. Now, the study had various mixed methodologies, but I'm going to focus on the focus group discussion aspect, which aimed to evaluate the different parenting programs in 3 Arab countries. That was Jordan, Oman, and Morocco. And I'd like to highlight some of the commonalities of the focus group discussion outcomes, which were that number one, 100% of participants in the parenting education programs were females. Now, this outcome can be consistent with the stereotypical understanding of gender roles in the MENA region, where fathers are considered breadwinners and mothers as caregivers. But it could also mean that we need to dig a little further and try to understand why fathers are not attending these parenting education programs. For example, it could potentially be that they don't have the flexibility to do so, to leave work to attend, or that the parenting education programs are being held at times where the fathers can't attend, etc. Secondly, the enrollment of parents, mostly mothers, in parenting education programs is driven by the need to know parenting techniques, especially in relation to children with behavioral issues. Now, another driving force behind parental enrollment in parenting education programs was to protect their children and adolescents from technology risks, early childhood needs, as well as resolving family conflicts. Now, common positive outcomes of the parenting education programs were developments in children's personalities, the ability of parents to eliminate negative behavior, their ability to manage time and be able to communicate better with their children. And some of the common negative outcomes that were mentioned throughout the 3 focus groups was that there was an absence of a focus on youth within the programs. Another study we conducted was on work-family balance, challenges, experiences, and implications for families in Qatar in 2019. And this report aimed to identify the challenges and the experiences of working parents in Qatar and to provide evidence to examine existing work-family balance policies in Qatar. I'd like to highlight that some of the findings included that the majority of participants stated that the duration of parental leave caused the main challenge towards them achieving work-family balance. In Qatar, the current maternity leave in most sectors is 50 or 60 days, and current paternity in most sectors is 0. We don't have paternity leave as per the law. However, that doesn't mean that a lot of the organizations do have longer maternity leave and do provide paternity leave as well. I'd like to also highlight another main finding was that poor work-family balance posed a threat to the health of working Qataris. And here specifically, I'll look at the percentage of 65.1% of women in comparison to 28.1% of men reported feeling depressed, regularly down, or hopeless when imbalance between their work and family life is found. We also conducted a study on technology overuse amongst adolescents in Qatar. This was just a preliminary report which was published in 2021 in partnership with Hamad bin Khalifa University, the World Innovation Summit on Health, and the World Innovation Summit on Education. And the report provided initial findings related to parental views on the topic of excessive technology use by their adolescents. Now, some of the main findings of that report were that almost all parents found that technology use has negative impacts on their children and that their relationship with technology is not healthy. But then another main finding was that we asked parents if they knew of any source or services or help information that could support them in dealing with the issue of excessive internet use. And while 174 parents answered the question, out of which 98.28% said that they were not aware of any services that could help them deal with the issue of excessive internet usage of their adolescents in Qatar. We also conducted a project on adolescent well-being in Qatar, which we're now calling Tanshi'a. This was conducted in 2020, where we did a pilot study on 7 schools in Qatar. We implemented a survey on 1,157 participants, and that was the year that COVID hit. So we ended up reframing the entire study to pre-COVID and then during COVID. And so pre-COVID, it was conducted on 1,157 participants. And then during COVID, it was conducted on 442 participants, all on adolescents aged between 12 and 15 years. Now, there was a lot of statistics that came out of this project, but then one statistic that I'd like to highlight was that 5% of adolescents stated that they never received emotional support from their mothers, and then 11% stated that they never and rarely received emotional support from their fathers. Fast forward to 2022, 2023, where we partnered with the Ministry of Education and Higher Education and conducted a quantitative study with 76 public schools in Qatar on a sample of 9,046 adolescents between the ages of 10 and 18, which was followed by a presentation of these findings to policymakers in Qatar. And I'll come back to this at the end of my presentation. So if we look at all the research that was that specifically talks about some certain aspects on parenting, there are some key outcomes that we can take out of it. Commonalities within the research that we found. First is that the gender division in care, which of course is in line with global trends as well. Also the lack of knowledge in how to deal with adolescents and youth. And thirdly, that work-family balance is definitely an issue for parents. So to bring it all together, I want to take you back to the initial impact model that I talked about, linking research, policy, and advocacy together. The RPM. So research has been conducted and findings have been published. Well, what happens next? at DIFI. So this is where policy comes in. The policy, it has to be, I think one important factor is that there needs to be an enabling policy environment. And within that enabling policy environment here in Qatar, there is already a focus on the family and the importance of supporting families. And as part of that commitment to supporting families, we do have a National Committee for Women, Children, Elderly, and Persons with Disabilities under the auspices of the Ministry on Social Development in the Family. And it is within this committee, I would say it represents our gateway towards being able to raise policy recommendations, because DIFI does have a seat in this national committee. And we've already, based on our findings and the evidence, we've raised multiple policy recommendations. And some examples are that we've called for implementation of flexible working arrangements across all sectors in Qatar. We've also called for an increase in maternity leave to 98 days and an implementation of paternity leave for at least a week, as well as an implementation of childcare facilities in the workplace. Now, the policy, though, can't happen without some form of also working with partners and partnerships as well towards trying to implement some of the recommended policies and programs. So some examples of the partnerships that we have in relation to parenting are that we're currently developing a 5-year plan on scaling up of parenting education programs in the Arab region, and this is being conducted in partnership with UNICEF. Now, in relation to our adolescent well-being findings, we presented our findings to policymakers and parents and school representatives. And in 2023, Tanshi'a was born, which is a nationally implemented program on adolescent well-being in Qatar, and being led by the Ministry of Education and Higher Education. As the policy and partnerships and research all go through hand in hand, then we've got the advocacy on one side, kind of, I think, representing an umbrella where it is linked to research, policy, and partnerships. And in advocacy, so as we're doing all of that in advocacy, we're also calling for certain campaigns, trying to nudge the community, trying to nudge the policymakers. And so, for example, we are undertaking a national scale advocacy campaign to nudge parents to commute their kids with required policy change in terms of flexible working arrangements. And we're also currently developing an advocacy plan where we are planning on campaigning for the development and implementation of a national parenting education program in Qatar. So I think, to conclude, in order for institutions to support policy that advances parenting, there needs to be, number one, an enabling environment, and a lot of the policy recommendations need to be evidence-based. So evidence is really important in order to be able to then take it forward, and while partnering with other organizations, try to advocate for these evidence-based policy development and implementation. Thank you so much for your time.